Namasivaya. So, yeah, my name is Ganesh Babu Namasivaya. I head the Charity and Education Services in Shakti Peetam and Spiritual Center of North America. So, first of all, good afternoon and welcome. So, just I want to, before we begin this session, I just want to give a little bit of background and context about Shakti Peetam and Spiritual Center of North America, and specifically regarding the charity and education services, what we have done so far and what is our mission and vision, before I hand it over to Dr. Mahalakshmi Srinivasan here. So as most of you know, Shakti Peetam and Spiritual Center, the main objective of SC of North America is to awaken and to spread the spiritual consciousness. That is our main objective. However, charity and education service is the heart and soul of Shakti Peetam and Spiritual Center. Because our beloved Guru, Thiru Bangaru Adigadar, fondly called as Amma, has ordained to us that humankind, if we have to get rid of our past sins and karma, the only way is by doing charity. Therefore, charity is a very, very essential part of Shakti Peetam and Spiritual Center. And any major event that we conduct in Shakti Peetam and Spiritual Center, we always start with a charity. Be it like we conduct like a charity food drive or education services or anything. Again, without charity, we don't do any major event. We don't conduct it. And we really thank all our patrons and devotees who have been supporting us throughout. Whenever we conduct some charity drives, they have been supporting wholeheartedly. So I'd like to take this opportunity to thank everybody. So yesterday also we went and dropped off the donations at the home of the Sparrows in Chester Springs. So we'll post some updates today. And our next charity drive will be for Thanksgiving and Christmas. So please tune in, we'll post more details. And when it comes to educational services, our main vision is to empower people to kind of create a self-awareness among them, among the students, by imparting knowledge and providing mentorship for aspiring leaders, entrepreneurs, and future leaders, especially the youths. So we have been doing this successfully over the past number of years. We conduct this yearly scholarship. We award yearly scholarship to the students of AdhiParaSakthi Engineering College in Melmaruthur. We call it under our umbrella of Lead to Serve Wings to Your Dreams Scholarship Drive. We conduct this. And we have been doing a mentorship program for the AdhiParaSakthi Engineering College students. We created a one-year curriculum where we provided one-on-one mentorship, focusing on soft skills, presentation skills, communication skills, immigration to the how to immigrate to United States. We had eminent professors and entrepreneurs come and deliver those sessions, and it was well received, and the student community really appreciated our efforts. And we are proud to say that we have amongst our devotee base like eminent personalities in various professions, like Dr. Yosef, Dr. Mahalakshmi Srinivasan here, who's a doctor. We have professors from eminent colleges like Harvard and so on, Wharton and so on and so forth. We have teachers, we have professionals, we have entrepreneurs. So we are really blessed to have such a diverse skill set and who are willing to come back and give back to the community and do their part. So we are blessed, and we are seeking people to kind of continue, spare a little bit of their spare time and to come and participate and do something, give back to the community by doing such education services. So with that, today's session is more on healthy living by healthy eating by Dr. Mahalakshmi Srinivasan. She is a board certified family physician. Thank you, doctor, for being here for among your busy schedule. I know weekends, at least you need a little bit of breathing time, but thank you so much for taking your time and coming here and also doing your part, your bit to give back to the community. We really appreciate it. And we'd like to facilitate Dr. Mahalakshmi a small felicitation by Shakti Shanwanti.
Not be there. Like
So,
Thank you so much.
Thank you, Doctor. And today's session, I hope everybody would agree that people may have different point of views on types of diet. However, we all agree that nutrition is a cornerstone for healthy living. To talk more about it and take us through, I'd like to hand it over to Dr. Mahalakshmi Srinivasan. Thank you, Doctor. Over to you. And just a housekeeping rule, I know everybody is muted. Thank you so much. If anybody has any questions, please raise your hand. The host, we will or post your questions in the chat, and there will be ample time to ask your questions towards the end of the presentation. Okay. And people who are here, who are present here, if they have any questions, then wait until the presentation is over so that we can have a live interactive session. So thank you so much, Doctor. Over to you.
Okay, thank you so much. Turn on the mic or-
Yeah.
Good afternoon, everybody. Is it too loud or you okay?
Good.
It's okay. So yeah, I am Mahalakshmi. So I've been coming to this temple for several years. And first of all, thank you so much for this opportunity from Shakti Peetam. And Ganesh has been helping me to coordinate this in a very short notice. Thank you. So I grew up in Tanjavur, Tamil Nadu, and I went to medical school in Tanjavur Medical College. And then I did my OBGYN residency under Madras Medical College called Kasturiba Gandhi Hospital in Triplicate in Chennai. And then I came here. And after that, as you all know, we have to do the residency. We have to prove it that we went to medical school. So completed all the exam and then did my family medicine residency at Montgomery Hospital in Norristown, which is affiliated with Temple University. So since then, I was in different private practices, but for the past 15 years, I was with Einstein Montgomery in East Norriton. For the past year, actually, I switched my job to Department of VA. So currently, I'm working as a primary care physician at Coatesville VA. I'm also a part-time faculty at Jefferson Einstein in East Norriton. So precepting the internal medicine and family medicine residents there. So I'm also board certified in family medicine and lifestyle medicine. So that's why I just want to kind of promote healthy living by doing these kind of workshops. So thank you so much again for this opportunity. So we can just go to the topic. So the objectives are mainly, so I'm going to talk a little bit about like healthcare burden. Is it really a problem or just like a hype? And then the chronic diseases, what are all the problems we are coming across in a day-to-day living, and what is lifestyle medicine. So all recommendations are for adults, so I'm not including kids in these recommendations. Thank you. So disclosure, I don't have anything to disclose, no financial affiliations, no conflict of interest. And this is just a general overview. So please discuss with your doctor about your health concerns. Next slide, please. All right. So what is preventive health, right? So we want to focus on physical, mental, and emotional well-being. So usually 3 pillars for the preventive health are vaccines, cancer screening. So vaccines is so that we can prevent infectious diseases. And then cancer screening so that we can detect cancers early so that we can start the treatment early. And then lifestyle modifications to prevent chronic diseases. So today I'm going to focus on the lifestyle modifications. Thanks. Okay. So how do we do this? Because if we just see the doctor only during illness, then we cannot focus on our preventive aspects. So that's why it's extremely important for all of us to go for annual physical exam. So I've been seeing this in our Indian community. Most of us have like very good insurance, but we don't see the doctors for annual physical exam. And I guess you all know, even if you have a high deductible plan, annual physical exam is 100% covered by most of the insurances. So why do we need to do this annual physical exam? So we can know our numbers. It's extremely important. So the blood pressure, what's our blood sugar? As you all know, what is hemoglobin A1C, which is the average blood sugar for the past 3 months. And then body mass index, which is the ratio of our height and weight. And then when we do our blood work, we also get our cholesterol checked. As you all know, there are like different fractions of cholesterol. Total cholesterol, triglyceride, and the LDL, they are called as bad cholesterol, and good cholesterol is a HDL. So it's better to know our numbers. Next slide. Okay. And then I'm going to talk a little bit about the body mass index. So which again is the ratio of the height and weight. There is a formula for it. So 20 to 25 is normal, 25 to 29 overweight, 30 to 39 obesity, more than 40 is morbid obesity. But for our Southeast Asians, even the 25 BMI is abnormal. So our goal is to keep it less than 23. Why is that important? It's because metabolically and genetically, we have a tendency to accumulate fat around the waist. So that's why it's called central obesity. So that is a bad fat. That indicates visceral fat. Visceral fat is the fat around the organs like liver, muscle, and those kind of things. So it's very easy to measure waist circumference. Not many doctor offices do this. We can do it at home. Just like, take an inch tape and then just measure it at the level of the belly button. It should be less than 35 inches for women and 40 inches for men. If it is more than that, there is a metabolic problem. Next slide, please. Okay. So what is metabolic syndrome? This is something like, it's not something new. It's been there for like more than 20 years. So the first time when I heard it was when I was doing my endocrinology rotation. So the endocrinologist asked me, like, so many vegetarians in India, but why is India the capital of diabetes and kidney disease? He asked me this question 20 years ago. And where are we now? Things are getting worse and worse. We are not getting any better. So that's why we need to focus on this metabolic syndrome. This we can diagnose this problem, even diabetes, pre-diabetes, or heart disease, like years before it's going to manifest clinically. So it's better to know our triglyceride number if it is more than 150, and the HDL, which is a good cholesterol, if it is less than 40, blood sugar more than 5.7 A1C, and waist circumference, like I said, the 35 and 40 number, and pre-hypertension. As you all know, even recently, they reduced the blood pressure numbers with the recent guidelines, okay? So anything more than 130 over 80 is considered as like pre-hypertension. If we have any 3 out of 5, that means we have metabolic syndrome. What is the problem with that? It increases the risk for diabetes and heart disease. Next slide, please, finish. So why do we need to focus on this? So that we can prevent these chronic diseases. So what are the chronic diseases? As you all know, it's type 2 diabetes, hypertension, high cholesterol, heart disease, cancer, lung disease, especially the emphysema, chronic bronchitis, fatty liver, obesity, PCOD, which like PCOD, we were not talking a lot about it like even 10 years ago, but now like a lot of women have these issues, especially in their reproductive age group. So the problem with these chronic diseases are they are not due to infection. And of course, there is some kind of a genetic predisposition. Mainly, it's all due to the lifestyle problems. Yes. Okay. So again, what is the epidemic of the chronic disease? Right? It is, we know about pandemic, right, with COVID problem, but chronic disease is a huge, huge problem. 6 out of 10 adults in USA has at least one chronic disease. 4 out of 10 adults have 2 or more chronic disease. So it's a problem. So 42% of US adults have obesity. So 40% men and 35% of women have like BMI more than 30. If we look at our Indian population, at least like, our weight, even if it is more than, if the BMI is more than 27, we are considered as obesity. So the numbers are like growing and growing. Can you, yeah, just yeah. So where are we with the 1970s? So it was only 15% of adults in US were obese, but right now it is like 40%. So it is really alarmingly increasing. And 1.7 million people are diagnosed with cancer every year. Again, we blame on the family history, right? So DNA is not our destiny. Even if we carry the gene, only there is a 30% chance we are going to get that disease. So lifestyle matters more than the genes. So epigenetics is a fascinating field and it's actually a growing field. Just because we have the gene, it's not going to be expressed. Okay. So if we keep the environment like unfavorable, it's like think about a seed, right? So yes, there is a seed, but if the soil is unfavorable, it's not going to germinate right away. Same thing, by doing like a good nutrition and active physical, lifestyle, we can actually make this gene to be suppressed. So what's the root cause of obesity? To tell you the truth, we don't know for sure what is really causing this. So there are four main factors, right? Behavioral, genetic, environmental, and metabolic. So we know a lot about behavioral and environmental factors, but we are still learning a lot about genetic and the metabolic factors. Okay, sometimes again I come across this in my practice too. Like, I will when I order the blood work, in my mind, I'll be thinking, oh my gosh, this patient is going to have diabetes, abnormal cholesterol. Surprisingly, everything will be normal for that person. Whereas the other person will be like very thin, very, like, no smoking, no alcohol use. I'll be thinking, okay, it will be completely normal, okay. But that person will have a lot of abnormalities. So we don't know the reason. But again, what we know so far is like the calorie in, calorie out concept is not winning so far. Okay, if we know that, if that formula is so simple, we would have really solved this problem, and we are not able to. So, what is healthy lifestyle, right? So, these are the four factors. If somebody is a non smoker and BMI less than 25, if somebody is having 5 servings of fruits and vegetables, and if they have regular physical activity, considered as healthy lifestyle. So, how are we doing in the society? If we look at the smoking, about 86% are non-smokers, which is good, which happened only in the past 20 years because of all the smoking campaign happened, right? They cannot just like smoke outside and so many restrictions. That's how we are able to reach that 86%. And then if you look at the BMI, about 27% of the people all still have like a healthy BMI. 5 servings, about like 30%, which is not bad. Regular physical activity, 20% still not okay, but it has to go up. So what is the percentage of population who has all four healthy lifestyle? Yeah. Only 3%. That is shocking, right? So we have to work on this 97% of the population to improve their lifestyle. So by following all four healthy factors, what happens? 78% of the chronic disease can be reduced. So I know some of you are working in the pharmaceutical company. Today, if we have a medication which can decrease something by 80% or even 60%, that will be a blockbuster medication, correct? So we need to work on the lifestyle. So is this chronic disease health burden? Is it a problem just for the individual, just for the family? No, it is for the society, right? So that's what we are going to focus a little bit. So what are the top 3 causes of death in 1900s? People were dying due to pneumonia, TB, diarrhea, mostly infections. That's why there was so much focus on the vaccines in 1900s. But in 2000s, what's going on? Heart disease, cancer, and stroke. So that's why it's real epidemic. It's non-contagious. There is no vaccine for it. We have to really work on it. So I put this data in 2021 because, I could have got from 2022 too. But the reason why I brought this in 2021 is we all know about COVID pandemic and we thought like everybody died due to COVID, right? Even in 2021, the top 2 causes of death were heart disease and cancer. And the major lesson we learned during COVID pandemic is people who had obesity, diabetes, or any lung disease, their mortality and morbidity was higher. They had more complications and the increased rate of death in that group. That's why there is so much emphasis on the chronic diseases nowadays. And the other point I want to stress on this slide is all the stuff I highlighted, right? These are all the reasons As a primary care physician, I have patients in the office. Yes, 20% due to like cold, UTI, some kind of infections and sprain accidents and things like that, but mostly 80%. So day in and day out, we are doing this, but are we making any progress? We are not. So again, how is it impacting the country? If you look at the centers of Medicare and Medicaid, they are the one who report about the US healthcare spending every year. There is a lag time, that's why we don't even have the 2024 data yet. So as of 2022, we spent like $4.5 trillion. That is a lot. And projected to cross 5 trillion in 2024. What did we do in 2020? 4.1. 2021, $4.3 trillion. In 2010, when I attended a quality improvement conference, the keynote speaker was telling that we crossed 1 trillion in the healthcare expenditure, which was 15 years ago. And right now we are in 5 trillion. This is like, we cannot afford this. Why can't we afford this? Because 20% of the GDP goes in the healthcare expenditure. But what are we doing with this? We are paying the hospitals, the nursing homes, mental health conditions. So we are still spending on the illness, but not investing in the health. So it's really not good for the future generation. So we are spending close to $5 trillion. How are we with our quality of care or life expectancy? It's going down. It went from 77 to age 76. And even if you look at the other developed countries, our healthcare metrics are not great. So, high time for us to focus on the root cause, right? So, 40% of the chronic disease happen because of this, right? Smoking, poor diet and physical activity, alcohol. So, by doing the lifestyle intervention, we can actually reduce the healthcare burden and also the cost. So, like I said, with all the smoking campaign, with the smoking cessation programs, we have done a wonderful job with that. So it's alcohol consumption. So it's more like individualized, right? So as a society, as a family, it's high time for us to focus on the diet and physical. As we all know about these quotes, right? If we do the same thing over and over, we cannot improve. And then, like Gandhi said, we need to bring the change. So what is lifestyle medicine? Is it really like a hype or it's a new kid in the block? No. American College of Lifestyle Medicine was founded in 2004 and it's evidence-based practice. It's not about like anecdotal data like okay, one doctor did this and they found success. No, it's evidence-based. It's all like, published in reputed journals like New England Journal of Medicine, JAMA and things like that. So it helps individuals and communities. So what are we doing? Are we doing any medications? No, we are just focusing on the lifestyles. So by doing this, we can prevent, we can treat, and also we can reverse the progression of chronic diseases. And lifestyle, this American College of Lifestyle Medicine, they are actually talking to Congress about this. Even they are actually talking to a lot of health insurance companies. They created some of the codes like type 2 diabetes in remission. So that we used to think, right, once you have diabetes, you always have diabetes. No, now even the insurance companies are receptive to these data. So what are the 6 pillars? So eating healthy, exercise, which we all know, and then sleep and stress reduction, which is very important. And we also need to focus on the relationships and also the risky substances. So I'm going to focus on all these 6 pillars in the next few slides. So how can we change, right? Like, yes, we are motivated. Of course, we want to reduce the blood sugar, reduce weight and all those things. But we need to know what we need to do. And then skill is like how to do it, right? Because a lot of us, like, we are not sure. And then consistency, that's very, very important. After this talk or after you see your doctor, after you review the lab reports, we are all highly motivated, right? But after that, it just goes away. It's like a New Year resolution, right? So because we rely so much on the willpower, and that's not going to work. Because motivation is like a visitor, comes and goes. But it's not our team member. So that's why we need to work more on the habits. we have to make it as a second nature. Because think about when we wake up in the morning, we don't remind ourselves to go and brush. We just do it because it's a second nature. So we need to actually build all the healthy habits like that too. And the other important thing about the lifestyle medicine is we are going to meet people where they are. Okay. Instead of kind of like a prescribing metformin for everybody, prescribing a statin for everybody. So each person is different. So we are going to work with them about reviewing all the 6 pillars and then find out what they can work on. Behavior change is not easy. We are all trying that, right? Like, January 1st, we all make resolution and then we break it by end of January. So let's not aim for perfection. Just trust the process, start somewhere and keep going. Okay. And we are more like, health coaches. So we work with people to do what is the healthy behavior they have. Everybody has healthy behavior. And then how can we work with them to modify their unhealthy behaviors? So why is this important, right? When the sink is overflowing, allopathic medicine had taught us to mop the floor very, very well, but it has not taught us to turn off the closet. So that's why we are going to focus on the root cause. So again, as health coach, we make like a therapeutic alliance with patients so that we know what their values are and then we focus on that. And then we also set the SMART goals, like simple, measurable, achievable, relevant, timed. I know we are all using this in different quality metrics, right? Okay. So the first pillar we are going to focus on is healthy eating. As we all know, nutrition is a very big pillar. We all need to focus on that. So healthy eating is predominantly plant-based, okay? So doesn't mean everybody has to become a vegetarian or vegan, okay? You can enjoy, but predominantly plant-based. Again, French fries is also plant-based, right? So that we have to keep it like minimally processed. So those are the main goal behind healthy eating. And then the next thing is about focusing on low fat and high fiber diet. So what's the recommended fiber intake is about like 30 grams per day. On an average, we are all consuming only about 10 to 15 grams. So it's not enough. And the fibers come only from the plants. We do not get fibers from the animal products. And then the next thing is we want to focus on the fermented food and fluid, at least 2 liters of water per day minimum. Unless like if they have any issues like a kidney failure or heart failure or something, then you need to rely on, you need to discuss with your doctor. Nobody needs juice, soda, or any sweetened beverages. Even little kids, after 2 years, they don't need any of those. Why is the fiber important? Because now we are all talking about like gut microbiome, right? So we have about 100 trillion microbes in our body. They are not new, we are just learning them. They were here even before the human race came to this universe. So then people think like, oh, I can buy the probiotics, I am buying the best probiotic, I am paying so much. But even the best probiotic has only about 20 billion microbes. That's not enough. Why is that? Because the genomic sequencing, right? With all the microbes, they do the genomic sequencing to find out so that they can replicate that. That's how they do the vaccines and things like that. So far they have done only for the billion microbes. So it's going to take like several years for us to do the trillions of microbes. And the microbes are very unique for each person. So it's like fingerprints. Okay. And so how do we do that? Variety of plant-based food, and we all know about like eating rainbow, right? Different colors of food. And the bottom line is intermittent fasting or time-restricted eating, fiber-rich food, fermented food. Only these 3 things going to help to build the gut microbes. And again, importance about the fibers, right? And the gut microbes. When we eat the plant fibers, our body does not have some of the enzymes to digest it. So we rely on the gut microbes to digest those. So when they digest, they release something called like a small chain fatty acid, which is like a food for the inner lining of our gut. Okay, most of our body rely on glucose, whereas the inner lining of the colon rely on these small chain fatty acids. That's why when we have like a low fiber diet, people get a lot of gut problems, especially like colon cancer, is increasing even like in younger ages. So we used to start the colon cancer screening from age 50, but now they reduced to age 45 because there are so many people with colon cancer that. And then the gut microbes also give several micronutrients. If you go to the vitamin aisle in the supermarket or wherever, you get like so many micronutrients. We don't even know how much we need and how much or what proportion we have to eat. Okay, that's why FDA does not approve these micronutrients. Okay, and then gut microbes follow the circadian rhythm. That's why the time restricted eating or intermittent fasting helps. Again, we talk about like macros, right? Like, our food has like, our food should have 40% carbs, 35% proteins, and 25% fat. As we all know, like, our Indian food is high in carbs. So probably we are consuming like 150 to 200 grams of carb per day. So when we look for the low carbs, it's 40 to 50. Keto diet, less than 20 grams. I'm not promoting or endorsing keto diet. Just for comparison, I just put it as like a less than 20 grams of carbs. And then the other stuff, right? Like when 1 gram of carb is burned in our body, it gives like 4 calories. And then 4 kilocalories. Proteins do 4 kilocalories, whereas fat 8 to 9 calories. That's why it's a calorie dense food. So we need to be very careful with that. And there are some ways we can reduce the carb content and the glycemic index in our food, sprouting, lentils, or cooking with like, some tamarind, tomato, vinegar, lemon. They can all reduce the glycemic index. Just want to give some perspective about some of the numbers. Weight loss is not easy, okay? So even like to lose 1 pound, we need to have about 3,500 calorie deficit. Let me just explain more about these numbers. Our average diet has about 2,000 calories, right? That's average. And our work is all like this job. So we all burn about like 1,400 or like 1,500 calories. So remaining like 500. Even if you do any workouts, you're probably burning another 200 calories. Still 1,700 calories, right? 300 calories extra. Okay. So even if you do that in 1 week, it's easy to gain another 1 pound, right? Because it's our lifestyles like that. So it's very hard. At the same time, when we want to lose weight, we need to have that much deficit. That's why people get frustrated. So they do some kind of thing, some dietary change or some physical activities. And then after a week or two, they expect some weight loss and they don't get it. And they get kind of, oh yeah, whatever I do, my body is different and it's not working for me. So you have to stick with that for a longer time. Yeah. Oh, sorry. Sodium, our food also has like a lot of sodium in it. So 2,300 milligrams, just to kind of like a day-to-day life. Think about like 1 teaspoon of salt per person per day. That's all we need. So if you are cooking for like 4 people at home, you can put like a 4 teaspoon in a bowl. That's all you can use for a whole day. Even you can ration it, but do it for like the whole week, put it in a small jar or daily. So if somebody has high blood pressure or heart problems, they can have only half teaspoon of salt per day per person. So it's a lot we have to work on. And then other thing is like, even our younger generation blame us that our diet does not have enough protein. So we need about 1 gram per kg. So it doesn't have to come from animal protein, but even though it's easier to get the animal protein rather than the plant proteins. Other culprit is like sugar, right? So 1 teaspoon of sugar is about 4 grams. American Heart Association says like about 6 teaspoons per day for women and 9 teaspoons for men. So it's really hard. Keep it as like about 5 to 6 teaspoons because there are like so many food what we eat. It has some hidden sugar in it. Like salad dressings has like sugar in it. So focus on that and try to cut down even if we drink like coffee, like 3 cups of coffee per day with 1 teaspoon of sugar. On top of that, if we have like a dessert here and there, it's easy to reach that 3 to 6 grams. 6 teaspoons easily, right? Fat, how much fat we need? We all use like oil in our cooking, right? So 1 teaspoon of oil is about like 5 grams of fat. Sometimes we think like, okay, you know what? I don't eat deep fried foods, but still, it's kind of very easy to do that 5 teaspoon of oil per day. And then what kind of oil we use? That's also very important because olive oil. I mean, we all know about the smoke point, right? Our normal cooking temperature is about 375 to 400. So olive oil smoke point is like very, very low. So with coconut oil or peanut oil, ghee, avocado oil, they all have like a high smoking point. So if we are deep frying, try to use one of those rather than like, the canola oil and all those refined oils are not good. So stick with those. Stick with the oils which has like monounsaturated and the polyunsaturated fat. And this is another question, do we really need to drink milk? Do we really need to do dairy products, right? So why is this important? Again, like, taking back to the nature a little bit. So the milk is designed mainly for the cows, not for us. Because for the cows to go from like baby calf to the cow in about like 18 months. So they need a lot of like proteins, high calorie food. Whereas humans, it takes like 18 years for us to reach the adulthood. That's why we don't need the calorie dense milk every day in our life. Of course, kids need it, everything in moderation. So even nature has a way of dealing with it. The lactase, which is an enzyme, which is the inner lining of our gut. The level of lactase, no, I'm okay. So the level of lactase in the gut goes down when we get older. That's why a lot of people get lactose intolerant later in their age. So the message from that is like, if you want to drink milk, absolutely fine, but drink in moderation. So the next step is about physical activity, how much physical activity we need. About 150 minutes, which is like 30 minutes a day, at least 5 times a week. That is just for maintenance. If somebody has to want to lose weight, want to lose blood sugar, or want to bring the blood sugar, cholesterol down, or something, they have to do more. And the key point in that is like moderate to vigorous. Many of us don't do moderate to vigorous. We do like a casual walking, which is good. Any kind of activity is beneficial, but we have to do more. So let me just explain how do we know it's a vigorous physical activity? If somebody cannot talk or somebody cannot sing when they are doing the exercise, that is the vigorous. If they can talk but they cannot sing, that is moderate. So even when we walk, we are not, many of us are not singers, at least I'm not a singer. So anyway, so when we talk, when I go walk with my friends, we talk and walk. But do some rapid pace at least in between so that you can enjoy your socialization at the same time you get the most out of the physical activities. And then there is something called like a metabolic equivalent test. When we do the temperature, we do that in like a degree Fahrenheit and those kind of things. There is a MET. So again, it's kind of putting things in perspective. When we sleep, how many METs do we spend? 0.9. Okay, so we need that to maintain our heart activities, our metabolism going, and all this stuff. When we sit, we do only 1 to 1.5. So not a big difference. And most of us are sitting and work about like 8 to 10 hours, right? So we are not really spending a lot of calories. Whereas when we walk, we do about 2 to 2.5, or at least when we stand. So that's why, try to have standing desk when you are working so that you can spend a little more calories. And then when we walk, it's about like 3 minutes. Whereas when we run, 18 minutes. Okay, so any kind of activities, whatever you like, do it. And the message in this slide is try to avoid prolonged sitting, which we are all guilty of it. And try to do the standing part. Sitting is called like new smoking. If somebody is sitting for 8 hours, it's equivalent to smoking 1 pack of cigarettes. It's huge. All right, so the next step. So we covered like healthy eating, then activities, then the next step is highly underrated sleep. We all think we don't need that much sleep. We are all superhuman beings, right? So 7 to 9 hours average adults need. Does everybody need it? Not necessarily, but at least we need about 6 hours of sleep. So 20% of adults get less than 6 hours of sleep, so which is not really good. Why is this important? Because our body goes through the cleansing process, the detox process when we sleep. And then when we are awake, there is a lot of oxidative damage in our system. That repair happens only when we sleep. And then the memory transfer, because our short-term memories are converted into the long-term memory, like our computer downloading system. Yeah. So the next point is about the risky substances. We all think about like, oh, I don't do alcohol, I don't do drugs, I don't smoke, but we all do sugar, oil, and salt. Those are the risky substances for us. So I told you about like what are the recommended quantities. So try to focus on that. And look for added sugar. Sometimes like, we buy food from the grocery store. We cannot prepare everything at every time. And even the granola bars, if you look at it, it's very difficult to find a granola bar with less than 5 grams per serving. Even like, you pay $2, $3 per granola bar, read the labels, so it'll be shocking. And then, like I said, sauces, dressings, juices, they are all like a hidden sources of sugar and processed food. As we know, they actually add more oil and salt to increase the shelf life. Social connection is very important. So that's why thanks for organization like Shakti Peetam. So like, you're all promoting the social connections. So why is this important? You probably, many of you heard about something called like a Harvard Health Study. You heard about it, right? Okay. So what happens is they have like a longitudinal data for more than 20 years. So they send a survey to all the Harvard alumni every year. They measure like different things, but one thing they measured is about the happiness, how happy they are. As we know, like, they went to Harvard. I'm pretty sure they are all like, highly accomplished people. They settled career-wise, financially and everything. But people who are happy are only people who had the social connections, strong social connections. It's not like kind of, yeah, I have like so many followers in Instagram, I have so many contacts. It doesn't matter. Strong social connections are the important predictor of the happiness. So why is this important? Building healthy relationships. Then we think about like, okay, spouse, but it's also important, like, because we have to redevelop the relationships even with our parents. It's important. And also we need to set the boundaries. I know, like, some of the friends I know, they go through some hard time because of not keeping the boundaries, even with the close relationships. So it's important, even like when our kids are grown too, right? We need to set a boundary and we need to know how to say no to some of the things. And removing toxic relationships is extremely important. Stress management, very important. We can never be stress free. We all need to learn how to manage the stress. How do we do that? We have to find our hobby or our passion and try to do some kind of like me time. Our culture is very bad about that. We feel guilty about that. No, we don't need to, because if we are healthy, then only we can take care of ourselves. Then only we can take care of our family. And the most important thing about breathing techniques, that's why yoga, the prayers, they were all like built in our culture, and gratitude journal. So, say thanks to anything, or like we are all thankful for so many things in our life that really help us to stay grounded. So stress management, again, I want to talk a little bit about blue zones. How many of you heard about blue zones? Blue zones, okay. All right, that's good. So what happened when they did the statistics, right? So they found, interestingly, there are 6 places in the entire world where people lived beyond 100 years. So there is one place in Japan, one in Italy, Greece, one in Africa, one in, surprisingly, Loma Linda, California, one place in US, but nothing in China, nothing in India. But anyway, we don't know why. But what's the common thing they found in this small population is they all had purpose in their life. They did not retire at the age of 60 or 70. They were kind of following their passion, following their purpose, and they had strong social connections. and predominantly they were eating the plant-based food. So that's why find your purpose, as you all heard about this term, ikigai, which is a Japanese term. Find the purpose. It is extremely important in this country because I am an empty nester. Now I don't have to take my kids to anywhere. When I have downtime, sometimes I don't know what to do. So find your purpose. And then gratitude journal, very important. Self-care, like I said, and kindness, random act of kindness. So like you are all doing it. So please continue that. Why is this important? We need to maintain that happy hormones, which is like dose. So dopamine, which is our dopamine surge or goes up only when there is like a sense of accomplishment. People get that in a bad way, right? That's what drug addicts get that. But there is also a good way how to get the dopamine. Oxytocin, many of you know, like when the mom gives birth to the baby, there is high level of oxytocin in the body because oxytocin helps the mom to bond with the baby. So we can also do that. I mean, not necessarily we are not going to get that much oxytocin, but it helps, like hugging people, physical touch, or connecting with people help the oxytocin. Serotonin, which is like one of the hormone, help us to prevent depression. So you probably heard about a lot of depression medications. What they do, artificially they increase the serotonin level in the body. But there are natural ways how to increase serotonin. And the good thing about serotonin, or like a surprising thing is, the serotonin receptors are in the gut. Okay, so if we eat healthy food, then the serotonin goes up, then it actually keeps our brain like alert and less depressed. Endorphin, which happens only during exercises or physical activity. So if we keep all these four hormones high, we can all be happy. All right. So I told you my original goal was to talk about preventive health. So I just want to give message about stages of prevention. This is important. There are 3 stages defined by healthcare world. This is not my definition. So what is primary prevention? If somebody has like no health issues, they want to be healthy, they want to prevent diabetes, cholesterol, and all those stuff, that is primary prevention. So think about this is more like a 9th grade. Everything starting fresh, clean slate, right? Okay. Secondary prevention is like already they have high blood pressure, sugar, cholesterol, but goal is to prevent heart attack, stroke, kidney disease, and all this stuff. Think about this more like a high school senior taking all the AP exams and all this. Tertiary prevention, where things happened already, heart disease happened, kidney disease, stroke, or something happened, but we can still prevent the progression so that they can have a good quality of life. Think about this as more like a college level. Why am I doing this? A lot of people, right? There are so many things in the social media. Drink Jira water, drink this, stop medication. Then people who are in the tertiary prevention stage stop the medication. Okay? I know people, at least like in my family member, very sad to say, he was in mid-40s. He had diabetes, fatty liver. He stopped all the medications. Unfortunately, he died last year. That was really heartbreaking. So we need to know where we are, and then we need to work on that under the guidance of your physician. Okay, so yes, there are so many things in the social media available, and I know the lot of myth is about like your doctors never got instructions about nutrition. That is true. We never learned about Ozempic or Wegovy. I mean, those are all the things I'm prescribing all day now. I never learned that when I was in medical school. That's why we all do something called like a continuing medical education. So I'm sure whether you are in the IT field or a pharmaceutical industry, things are changing and we all kind of like adapt. So the reason why I did the 9th grade and the college level analogy is we cannot prepare for 9th grade exam and take the test for college level. Okay, so that's why it's important to find out where we are and apply appropriate prevention strategy. There is something called neuroplasticity where brain can learn anytime. Okay, sometimes we think, oh yeah, I'm 60, I'm done, my life is done. No, even at 80s, 90s, we can learn so many things. So we know healthy citizens are the greatest asset. Like, many of you speak Tamil here. Like we all say that, நோயற்ற வாழ்வே குறைவற்ற செல்வம். So the doctor of the future should not give like any medication. It's more about like the diet, and we have to focus more on the prevention, because that is the only way we can actually reduce this healthcare burden. If you forget everything, whatever I said today, just remember these 3, 2, 1. Okay. So stop consuming any calories 3 hours before bedtime. That's important. Why is that important? When we eat something, our stomach actually processes the food and send it to the small gut. It takes about 3 hours. But when we go to bed, like in full stomach cannot digest that. Kind of like, the process is slowing down. That's why it's important to finish it 3 hours before bedtime. Minimum 2 liters of water per day. Measure it, or whatever the strategy works for you, please do that. And then wait for 1 hour when you wake up in the morning before consuming any calories. Bed coffee is definitely not good. Nobody's giving bed coffee, I guess, nowadays. And then at least 1 fermented food per day. Whatever we can do, as many of you know, each culture has some kind of fermented food in their food. So healthy eating and active living so that we can heal many diseases. Thank you all. And please let me know if you have any questions.
I have some question in the group.
Yes.
Like great insights, Dr. Mahalakshmi. I would appreciate your insights on maintaining healthy blood sugar levels. In addition, how do you prevent early AM spikes? And lastly, is there a direct correlation between the tenure of a diabetic and the recommended A1C levels?
Okay, so the last question is about like the tenure of diabetes and the A1C level. No, there is no correlation.
Okay.
So the recommendation is based on your age. So if somebody is like 75 and up, we are not aiming for less than 7. So 75 and up, we are aiming for less than 8, because lower blood sugar can do more harm in that age. So that's why we don't want like a tighter control when people are like at the older age. But then, like, in between, we want to keep it less than 7. But if they are like 30s and 40s, unfortunately, we have a lot of patients in their 30s and 40s with type 2 diabetes. So keep it closer to the normal range, which is about like 6 months. Okay, it's nothing to do with the duration of diabetes. Number 2, about like AM spikes.
AM spikes.
Okay, so AM spikes, like I said, like, 3 hours before your bedtime, finish your meal. That way, your calories are not there when you wake up in the morning. So our body go through the detox process, the glycogen, those kind of things. And what's the other question about the meds?
How your insights on maintaining healthy blood sugar levels? How do you maintain a healthy blood sugar level?
How do you maintain? It's about like high fiber diet. First, I said like about low carb, right? So we want to focus on the carb content. That's important. So of course, we are going to feel hungry. So replace it with more protein, more fiber. That's going to fill you in. So if you aim for 30 grams of fiber per day, so then it's kind of easier to get or maintain the blood sugar level, because fiber actually decrease the glycemic index. That's one thing. Complex carbs is another way. And then the physical activities if somebody has like diabetes or pre-diabetes, they need to do at least 30 to 40 minutes of 45 minutes of like cardio, and replacing that with muscle strengthening exercises at least 3 times a week. Because muscle can burn calories even when we are sleeping. So building the muscle mass is very important. So that's another way. Of course, if the A1C is going beyond like 6.5 based on your age, or like 7, then you have to think about me. I hope I answered that question.
Yeah.
Okay.
Any other questions in the chat?
Yeah, if anyone has any questions, maybe you can unmute and ask your question.
Yeah, they can unmute.
Yeah, unmute yourself and ask your question. But maybe here, Doctor, I myself have one question. You don't mind. Yeah, like you said about fasting, right? At least in my family, they used to tell that you have to eat, don't fast because you'll get ulcer. So you have to eat on time and things like that. So is there a correlation, doctor? If we kind of eat nowadays, this one meal a day is becoming very
Mhm.
popular.
Right.
Will it cause ulcer, or is it like
No, we have to train our body. Okay. So first of all, our body, like for so many years, it used to have those insulin spikes in those times. Okay. More than the insulin, there is something, another hormone called ghrelin. Okay. So ghrelin, which is called like a hunger hormone. Okay. It's like, when we eat like certain times, right? For example, for so many years, you ate breakfast like around 8 a.m. So your ghrelin is going to spike at that time. Okay. When we don't, along with the ghrelin, the stomach acid also goes up. That's why people are saying that if you don't eat, you get ulcer. But we have to train our body slowly by increasing that fasting window and reducing the eating window. Once you do it gradually, you are actually training the ghrelin hormone so that the ghrelin spikes only with your regular eating time. So if you look at it, people who do like Shakti Peetam and all the Ekadesi Viradam and all, they don't feel hungry during that time. It's amazing because that's how they tune their ghrelin. That's how you look at it. Like most of our fasting times are aligned with the lunar cycles because there is some kind of correlation. I don't know a lot, but there is some correlation with that. So answer to your question, like yeah, we have to train our body from tomorrow. If you're eating breakfast, for more than like 20 years, and from tomorrow you stop eating breakfast, of course it's going to happen. That's why people say, oh, the fasting is not working for me. You have to really train your slowly for that.
thank you.
The intermittent fasting, doctor. So I'm doing that, but I'm not fully into it because people keep saying if you have a tea in the morning or coffee in the morning, then that is not intermittent fasting because it has milk in it. Is that true? Or?
It is true. It is true. Yeah, I've been doing intermittent fasting for more than 5 years. So, but I did not start it overnight. You have to do it like very, very gradually because as you know, like with my work style, right? I always like eat breakfast at 6:30 or 7 in the morning. I never ever left my home without that. But then it was a big change, but I'm so glad I did it. And it works. But you have to do it under guidance, right? We cannot just take it's like a medication, but you need some kind of guidance and then you can do it. Yes, if you eat any calories like a creamer or milk or sugar, then it causes some insulin spikes, then it's not intermittent fasting.
And what is your opinion about all these fads that comes on all over the net and like fenugreek, cutting okra and because I'm diabetic, right? So I'm asking, is that all working or?
Yeah, fenugreek, yeah, it has like some kind of insulin in it, definitely. That's why they are doing like fenugreek powder, even in Ayurveda, Siddhar, they're all using that. There is some value to it. But I mean, you cannot just, not saying you, like people just stop metformin or stop whatever their medication is. So you can slowly add that and find out how your blood sugar is. So usually I recommend those people buy like a CGM, like a freestyle libre or something, so that you can monitor your blood sugar very, very closely and gives you a lot of insight about your metabolism and what you can eat and when you can eat and how much you can eat. So that's like a wonderful technology. We should all use that. CGM.
But still, that CGM, what I'm getting or reviewing from it, right? That CGM is still, you have to add 20% to your blood sugar. Is that
It's variation.
Okay.
Even if you do something in CGM, even some patients, if they call us like, oh, my sugar is like 400 with the CGM,
Yeah.
then we always tell them, okay, do the finger stick.
Got it.
And then we can actually find the correlation. Yeah.
Okay.
Because it's a different measure, right? Because this is measuring the capillary blood, whereas this one is not. So there is a difference.
So in CGM, what should be your reach?
It depends whether they have diabetes, what kind of medications they are on, and all those
For
things.
a diabetic with a metformin?
Metformin, like you could do 120 to 130, 140, depending on the age too. Yeah, because for somebody who is like older, we don't want to have that kind of strict range.
Okay.
Yeah, and again, I tell people like soon after eating, the blood sugar is going to go up.
Yeah.
Right? Because that's when the insulin goes up. It takes at least 2 hours for our body to process that. So check the blood sugar at least 2 hours after meal. That way we know.
And actually, the problem is, like you said rightly, the CGM is really helping. And blood sugar is also increasing because of your stress levels.
Yes.
As you talk more,
Mm.
your it's actually increasing, to
Yeah.
be very frank. So, is there a way to? So, see, as you said, like right now, sitting 8 hours is one pack of cigarette.
Right.
So, sitting on an what do you call an unhealthy call, I would
Mm.
say, how can you control it?
I mean, yeah, there are some ways, right? We can actually reduce our stress level. Of course, when you are in a meeting, when you are working with toxic people, I don't want
Yep.
to say that.
What?
It's like, it happens, it's all around there, we cannot be in denial. Of course, it's going to increase our stress. So, start your day in a better way, where like do your gratitude journal,
Yep.
do your breathing exercises. So already you kind of like increase your dose so that you can handle the stress little bit.
Okay.
And then of course, de-stressing at the end of the day, doing some breathing techniques or doing some exercises or like social connections. That's the way to go. I know it's not easy.
Yep, no.
It's going to happen, yes.
Doctor, if you don't mind, you can sit and take the questions.
That's okay, I'm okay.
Yeah, yeah, please.
I don't want to.
Okay. Yeah, yeah. So there are a couple of questions online.
problem.
One is, thank you, doctor. Any advice on cholesterol control? That is first question. And any relation of vegetarian diet and cholesterol level due to less protein intake?
Okay, so vegetarian diet, the problem is the low protein. Okay, not necessarily about the cholesterol if you prepare the food like properly. Like I said, French fry is plant-based, but it's not healthy. So if we process the food a lot, and lately, our social connections are good, but too much socialization, we are eating bad food, right? Because culturally, we are relating food and hospitality together, right? If you go to somebody's house and if you tell them I don't want to eat, they think that we are disrespecting them. So we need to kind of unlearn some of these stuff, and then we have to understand what people are. So that's why, since I am doing the intermittent fasting, so when I visit people like after 7 p.m., I tell them I don't eat. So now my friends know. So I know how to eat like after 7. So they all know about it. But if I'm going for a party, that's the flexibility, right? I mean, today I'm going for a party, in Diwali party. I'm okay. I'm going to enjoy the food. So that's about the thing. So second thing about the cholesterol, what was the first question?
So, any advice on cholesterol control? The second thing is vegetarian diet and cholesterol levels.
Like I said, if you prepare the food properly, minimally processed and less oil, less salt, less sugar, then it's okay. But whatever we eat, everything will be converted into calories or blood sugar, right? So if our body has extra glucose, that will be converted into cholesterol eventually. So that's why calorie content is important. And in general, about cholesterol is like low fat and high fiber. Again, bottom line is like increasing fiber to about 30 grams per day. And then there are lot of fiber rich food like flaxseed powder, chia seed, and lot of vegetables. Then you can increase the fiber content so that you can reduce the cholesterol content. A lot of people are adding a lot of nuts nowadays. They are like calorie rich also. That's also eating in moderation is extremely important. If somebody has cholesterol and in spite of all these things, then we can also try some medications like red yeast rice, which is more like a herbal supplement. They can try that. And if no improvement, depending on there are risk factors. We do a calculation about what are the risks for this person to get heart attack or stroke in the next 10 years. So if you have those risk factors, keep an open mind about statins or cholesterol medications. Okay, so we don't need to be in denial all the time.
I do have a question. So if I do the intermittent fasting for like 18 hours, how do I manage my fiber and everything together for the day? I have to take everything at the same time. So is that
It is a problem, but you have to really work hard for it.
okay?
So, you have to do like a meal prep and make sure like, you have a lot of vegetables, fruits, and then like, look for like beans, because, even if you have like a half cup of red beans, cooked beans, that's like 5 grams of fiber. That's kind of easier to get. Spinach, if you cook it, half cup of cooked spinach has 5 grams of fiber in it. So those are some ways, and adding chia seed or flax seed, you can actually add more fiber to your diet too.
There is one question I think most of us might have, is a cup of coffee a day okay?
It's okay, perfectly fine. Yes, endorsed.
Yeah.
Or the-
They can be happy. I think they can be happy. Oh.
So you make myself black coffee or with?
No, that is not clear.
I know.
Not-
So the thing is like, okay, if you're doing like time restricted eating, we are not even saying intermittent fasting anymore because that has more like a negative notation about it. So just to keep like a positive approach, we say time restricted eating. So you're eating sometime. So that's great. So if somebody's doing it, then it's better to do the black coffee during their fasting window. And if they want to do like the regular coffee with milk and sugar during their feeding window, it's okay. 1 cup is all right. But again, caffeine can stay in our system, believe it or not, for 4 hours. So that's why if somebody drinks around 6 p.m., it's going to affect their sleep quality. So that's why it's better to do it like earlier.
I have a question, you talked about the visceral fat and.
Yeah.
Is there, how to determine the fatty liver? Is there any test or?
Yeah, a couple of tests. One is simple test like blood work. When we do like a liver function test, there are a couple of enzymes will be like in the borderline. And then along with that, if we have the waist circumference of more than 40 and 35, the next step is like doing an ultrasound of the liver. And that can tell us because it tells us about the eco texture of the liver. So they can diagnose fatty liver by doing that. And there is also elastic scan, which is like an ultrasound, but they can actually measure the elasticity of the liver in that. So that's how we know about the fatty liver. And the
These
fatty
things we have to request to the.
Yeah, first.
PCP to.
Yeah, basic things you can request. Everybody will be getting the liver function test along with the routine blood work. And the second thing is about waist circumference, we can all do it. And then if the liver enzyme is borderline, the next step is you can get like a liver ultrasound, which is done anywhere. But the elastic scan is not done everywhere. It has to be done only like few places. So bringing about fatty liver, right? It's a very important point. So there's something called liver cirrhosis, which many of you heard about it, right? It's like a scar tissue in the liver. Liver is a wonderful factory in our body. Whatever we eat, whether it's a medication or food, everything has to go through the liver. Liver has to process it. So few years ago, right, when it has like mostly scar tissue, it's not going to function, right? Even if we have like a little bit, even 10% of the liver, it's going to do phenomenal job. But when people have like, insulted or like, ignored their health, then it's going to be replaced by scar tissue. That's what called the liver cirrhosis. So like several years ago, the common cause was hepatitis B. That's when you knew, like, we did not get the hepatitis B vaccine, but our kids got, like even 20 years, 30 years ago, even in India, we all got the hepatitis B vaccine. Then we cured that. Then the second problem was hepatitis C. Now we can actually diagnose everybody with hepatitis. We have wonderful medication. We can actually cure hepatitis C. Then the problem was alcohol, right? Even like now, that's not even the common problem. Fatty liver is the common cause of liver cirrhosis now. Yeah, so that's why it's better to kind of reverse it. So I don't mean to scare everybody about this, but this is completely preventable. But because, like I said, liver has like an amazing capacity to heal and regenerate. So there are ways to make it.
One question related to fatty liver, doctor. It is said that most Asians, right, like we eat a lot of rice and carbs. So is carbs one of the main reason for having fatty liver? Or is there a different reason? Because is that a myth or?
I mean, yeah, genetic, like I said, there is some role. But if you look at it, like I said, 1970s, what was the incidence of obesity? It was like very low. Whereas now, like, if you 60% or 40% of the people are like, on the overweight side. So that's why it's all like, created by our lifestyle too. No, it's not related to the carb alone, but problem with our carb is we eat mostly like a processed or simple carbs. Okay, so white rice, white pasta, white bread, those kind of things, and lot of sugar in our diet. So those are high calorie food, and they will all be converted into sugar. Okay, so when it has so much sugar, pancreas cannot process it. It will be shocked. That is what happening. That's when we have something called insulin resistance. So to handle that much sugar, pancreas is making more and more and more insulin. It's like our kids, right? We kind of scream at them every time they don't listen to us. That's how our body is. It's not even listening to the insulin anymore. So what it is supposed to do, it has to push once the insulin comes, it just opens the key. So the sugar from the blood should go into the muscle so that muscle can burn the calories. Now, even if it goes to the muscle, we are not burning, so that will be converted into fat. So that becomes the reserve fat. So ultimately, everything, the bottom line, healthy eating and active.
I have another question, doctor, related to the vegetarian diet. I don't know if it's a myth or like if it's a reality. People always tell that human body is meant to digest animal food faster, or like it's meant to eat animal food. Is that really a myth, or like you said, plant-based food is kind of thing? So how do people who are like true pure vegetarians without egg or anything, how do they get the proteins, or any recommendations? Like,
Yeah, there are a lot of plant-based proteins. Even if you like, Google, or like, I can also send you the information about the plant-based proteins. There are a lot of options available. So really, nobody knows. Like, okay, if you look at people like, who are like, non-vegetarians, they believe that is the way to go by. If you go talk to the vegetarian, that is the way to go by. Everybody has their own evidence. Somebody says, okay, our gut length is this, and we don't have the long incisors. So we are designed to do only like a vegetarian food. But bottom line, we all need to have more fiber in our diet. Okay, so they actually studied in one tribal population. I don't know whether it is in Africa or somebody. So they are eating 150 grams of fiber per day. But right now, our recommendation is only 30 grams. But we are not even eating 10 to 15 grams. Okay, when we can increase the fiber, that is the most important thing. Lot of problems are going to be solved. Right.
So there is a myth on that. So actually, when you go so close into it, like, okay, what food am I eating? Say, just let me put it this way. So I was trying to see how my sugar levels are going, and like kind of one day I started, okay, let me put only quinoa. And then, okay, let me put only brown rice. Let me try to put only white rice. So the problem is, even when you eat a little bit of a quantity, immediately your sugar is kind of going up. It's in an increment level. So it gives an anxiety. Oh my god, like my sugar is increasing. So okay, what am I supposed to eat? So it's like kind of you are running into a no man's world, and good that our all the PCP and everyone what they have started doing is okay, they are giving you guidance with your nutrition list, everything. But the problem, the actual problem here we have everyone. It's an Americanized land, and we understand. So they know only food habits of
Yeah, exactly.
the people who are locals here.
Mhm.
But we Indians are here. So what is our best way to get a nutrition who knows our Indian food? So because even in Indian food also, like you have a sattvic food. So
Yes, exactly.
if you really wanted to have your food in an sattvic food, so what forums or what materials we have for that kind of thing?
Sure. One is about like, first find out about how to get your 30 grams of fiber per day. Okay. All right. So again, find out how many grams of fiber you are consuming now. Okay. From tomorrow, you cannot go from 15 or 20, whatever you're eating, to 30 grams tomorrow, because our body has to get used to it. So a lot of people, they do it and they get bloated feeling, they get constipation, they hate me. That's why I tell them, you have to do it slowly.
Yep.
Because your gut has to get used to it. So I tell them, okay, if you have 15 grams now, go by increase, find a way, add one more food, and then like, stick with 20 grams for next like 1 week. And most important thing, you have to drink more water too. So a lot of people are like chronically dehydrated because we don't consume like 2 liters, even though 2 liters we should, we don't. So that's one thing. So regarding about the food information, My Fitness Pal, and again, I'm not endorsing, but it's a kind of like very easy. They have like a lot of food information in that one. And that will kind of guide you about the what you have to consume. It gives a lot of choices, right? So that way you can do that. And about the fiber, you are good at.
Yeah.
I don't know any specific nutritionist
Yeah.
recommending like the Indian food. We have to be our own guru.
Yeah.
Yeah.
That's what we are going.
Yeah.
We are just going with the co-pilot and chat GPTs and okay, give me the list of
Yeah.
Indian sattvic.
See, that's why, like,
Yeah.
with lifestyle medicine, they are promoting this health coaching thing,
Okay.
which is like a one-on-one session and that kind of like, find out, there are some kind of questionnaires. And then like find out, okay, where they need to focus on and then we kind of direct them. So, about, you asked one more question about the sugar, right? Don't check your blood sugar soon after you eat.
Okay.
Wait for 2 hours.
Okay.
Because it's going to go up.
Hmm.
Yeah, wait for 2 hours, that way your body, your insulin is going to work on it, and then wait for 2 hours.
That's all.
All right,
So, thank you very much, doctor, for a very captivating and very informative session. I'm sure everybody benefited from this session. I think, let's not forget 3, 2, 1, what doctor mentioned. That's the key
Can you
takeaway.
put the 5.4?
Yeah, sure. So the key message for everybody is 3, 2, 1. So stop consuming any calories 3 hours before bedtime, 2 liters of water per day, and at least 1 fermented food per day. So 3, 2, 1. So with that, I'd like to call upon Muthu uncle to kind of do a vote of thanks to Dr. Mahalakshmi Srinivasan.
Om Shakti. Thank you, doctor, for coming forward to come and share your experience and knowledge with us. The Shakti Peetam is actually founded on 4 pillars, as you all know. Bhakti, Seva, Dhaana, and Dhyaana. Dhaana is very, very important. Like, I'm not going to repeat what Ganesh said. But there is one thing that our Bhagavad always talked about is Kartadana. Kartadana is very important. Kartadana means even sharing your thoughts, good thoughts, your knowledge and everything. And we were discussing before you came, like this is the age of AI, where the knowledge is available around the world, abundant. I mean, there's nobody, I don't need to go to school to learn anything anymore.
Yeah.
If I know how to ask a question, I got the answer. Like he mentioned, AI, the co-pilot and Gemini and all those tools, ChatGPT and so on. But what I realized is, how do I know to ask a question? As we were talking here, many questions started coming up. These look like common questions, but they don't come upon somebody's mind as they are sitting and eating or something, they don't. So when you share your expertise in medicine and your knowledge, then it kindles our mind to ask that question. So we know what question to ask. That's the beauty about your sharing the Kartadana, bottom of our heart. Thank you very much for coming in and sharing your thoughts and your expertise with us. I'm sure there are a lot of things we have learned. I learned some. We'll never learn 100%. Anyway, and I'm going to remember 3, 2, 1. I took a picture of that also. So we hope that, and thank you, Ganesh, for arranging this. He's the head of the charity and educational services. He has been doing a wonderful job throughout this year, arranging for a lot of charity activities and educational sessions. And I think he's ending the year with a good note with your thing. I'm not even sure what he has planned for the rest of the year through December 31st. So thank you very much. We're looking forward to have you come and do more sessions,
sure.
more deeper sessions into specific topics. And today you gave us a good idea on better lifestyle. That's very important. And we're all going to make some changes in our life. Thank you very much.
Thank you so much.
Okay.
Thanks for the opportunity. Thank you all.
Thank you, doctor. And there was one question for any follow-ups. They're asking for your contact. Maybe we'll take doctor. What do you suggest, doctor? Like, how do they reach out in case they have any follow-ups? Like,
Yeah, I can share my email ID with you.
email ID.
Yeah.
Okay. So, doctor will share her email ID and we will send it over. Thank you so much, everyone, and have a good rest of your weekend. Thank you for joining.
Thank you all.
Thank you all.
Okay, thanks for the opportunity.
That one again really matters big time. So till connect.
Hi.
Dhaana will,
Oh.
Dhaana the founding board member, Dhaana the founding, comes from Maryland.
Oh, wow.
He's a pharmacist, by the way.
Oh, okay.
He's running his own pharmacy and so on.